This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the Ph.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to the Dr. Molly Show.
No, definitely not. Come on, John.
Welcome to Health Watch, another edition every Sunday right here on Talk Radio 1210 WPHT, 8 till 9. That's the time, and we're here, and we're ready to give you some information that can help you improve your overall quality of life, you and your family. And as I said, Dr. Molly Fantasia is here. She is the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And if you want to call in with a question or you want to run by a medical challenge that you may be having with Dr. Molly, 855-839-1210 is our number here in the studio, 855-839-1210. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And Dr. Molly, what does Innovative Medical have to do
with quality of life,
yes.
Right? Okay, well, that's a good question, John. First of all, shouldn't we ask everybody, are they recuperated from the Super Bowl?
Yeah, we should.
Yeah, I had a lot of patients who came in late, on Monday, right? You know that.
Yeah.
So that's why I want to lead into this, because if you're fatigued, you're a little bit under the weather, we're the place for you. But, John, Innovative Medicine is actually a group of like-minded healthcare providers who work out of my facility in Marlton, New Jersey. And we are a licensed primary care facility. So we can do anything your GP or your primary care doc can do for you. You need a pharmaceutical, we can order it. You need some blood tests, we can order it. Actually, we even draw it right in our own facility for patients who are our patients. We also actually can do any radiology you need, whatever. But it's our philosophy that really separates us from the crowd. We believe that we may be able to help you have a more important quality of life than normal in terms of your condition, because we like to use natural substances like vitamins, minerals, etc., the kinds of things you might buy in the health food store. So in doing that, we're able to reduce your need for some pharmaceutical, reduce the side effects of some of those pharmaceuticals, and still enhance the outcome of your medical challenge. And again, if you go to the health food store and you start looking, there are just aisles and aisles of vitamins and nutrients. Which ones are right? You come to a place like ours, we can help you.
It's overwhelming when you go to a health food store.
It's become even more so now that the big guys are in the game.
Yes.
And again, if you want to be judicious in what you're looking for, and you want to make sure that you have appropriate guidance, we use hydration, though, as the vehicle to deliver these nutraceuticals.
Are there any side effects to the nutraceuticals?
Sure, just like there's side effects to pharmaceuticals. It seems that the safety profile, though, is a little better for nutraceuticals than it is for pharmaceuticals in many ways. But, again, you want to use an appropriate amount of the nutraceutical, meaning certain constituents within the nutraceutical that will effectuate the change for a patient. That's why you want to come to a medical hydration facility.
People always ask you in the initial consultation, Dr. Molly, this sounds good and all of that, but does it work? Can you show a patient some sort of data or proof that it works?
Well, as I always say, John, this isn't holy water, and I say it when you start, and I tell you that most people can see some improvement between 5 and 10 treatments, but ultimately, in order to really get you to where you go, we've got to really take into effect what is it that we need to help you with. Where are you in your continuum from your particular challenge? For example, we just talked about this before the show. Why is it that people come to me as the last-ditch effort? I like to call it desperation medicine. Why? Come in early.
That's a good question.
That's something I'd love to ask the listeners. Come in earlier when we have a better chance of effectuating the change quicker than we do, let's say, at 20 treatments. We might be able to help you at 5.
You know, it's interesting. It seems like you always put the new patients next to me.
Oh, yeah, I love doing that. Well, they want to see you, man.
Well,
you have a fan club, buddy.
And it's interesting because the last time was a couple weeks ago. The patient said to me, "How long have you been coming here?" And I said, 20 years.
Yeah, I know.
And she, well, then this must work. Well, yeah.
Yeah, not only that, you know what, John, it's funny because people think, 20 years, that's so long. Well, really, when you consider the kind of comorbidities you have, no, sir. And the fact that you're still working, and I want to believe that we have a part of that.
Yes.
You're working, you sound great, you have other medical challenges, and we have to bite the apple one bite at a time. You know, I love people, they come in, I have 5 problems. Okay, I'm diabetic, I had a stroke, I have cancer, I have, okay. Well, what would we challenge first? Well, let's take them in order of importance. But what's important to you? I want to know when a patient comes in to see us, what is it that they expect? What is their goals? What do they look for? And I think that also separates us from most primary care facilities.
How many treatments can people expect
at
least to get started?
I would say 10 treatments is probably the norm, at least. And really, in most cases, 10 treatments, we really can see that we're on the right track. But is that going to effectuate the change you want? No. If you want to run a marathon, you might need 20 or 30 treatments.
Yeah.
You know what I'm saying? And if we want to tackle some significant medical comorbidities like, let's say, cardiac or cancer or significant autoimmune disease, we're going to have to look at a series of treatments and, in addition, some other things we need to do.
You've had all kinds of challenges in your career. Now headed to 27. Whoa, boy. I thought about that the other day. 27 years.
Me too.
But is there one case or one type of case that sticks out that you've had the most success with?
I would say that I've seen successes across the board. And look, a lot of that has to do with our patients, too. In other words, the successful patients really look at changing some lifestyle things. I've had patients who come to us with cancers who actually change their entire lifestyle, and as a result, they eat organically, they stop eating the red meat. All the things that Barbara and my nurses will talk to them about, in addition to doing what we do through the hydration therapy. And they tend to do very well. They're still with me. I can think of several breast cancer patients that I've had for approximately 15 to 20 years.
Speaking of Nurse Barbara, and she really does know her stuff when it comes to the health foods and the health food store.
That's right.
So what role does she play, and do you help patients, or do you tell them,
sure,
look, take this at home and take that at home?
And I will tell you something, it's becoming harder and harder. For example, I had a line in that was a great line of fish oil, and one of the best actually in the country, I believe. And it's happened that because of supply chain problems, I can't get that. So obviously we start to look at something else, maybe the second best. But again, I don't carry many oral products, as you know, for that very reason.
Yes.
But I will tell you that Barbara is really good at helping us ascertain which vitamins, which minerals, etc., what we do keep in stock and what our patients should be looking for. And we try to appreciate where a patient is at, meaning if the patient can't afford to buy something that's exorbitant in price because it is a good product, we'll go to the second best. And we know what's out there, and we then can adjust the drips accordingly.
It's interesting because all these people come into you with bags of
suitcases.
Health. The patient a couple of weeks ago showed me her picture of her closet.
Yes.
And there had to be 50 items in there.
It's an interesting thing. I get a lot of referrals from nutritionists, and good ones, very good nutritionists. But, man, do they load up their their particular patients with a lot of nutraceuticals. And I won't say don't take them. If you can take all those, God bless you. But I found that most of my patients in the end really are looking to cut down on some of those and letting us augment through the hydration.
We are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio, 855-839-1210. And we always tell you, and we'll tell you again, call early so you can be sure that we can take the time to talk to you about your particular situation. 855-839-1210. Health Watch is the show. I'm John DeMasi. Dr. Molly and I will return after these words. Hi, I'm John DeMasi, host of Health Watch, Sundays on Talk Radio 1210 WPHT. If you or someone you know is battling cancer, long COVID, or an autoimmune condition, medical hydration therapy may help to reduce chronic symptoms like pain and fatigue, so you or your loved one can live a better life. Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates have helped thousands of patients to improve their quality of life. They prescribe and deliver vitamins, minerals, and medications directly into the bloodstream where they can best impact your overall well-being.
We can bring a patient to a better quality of life and then a healthier approach to their entire condition.
Tune in to Health Watch Sundays at 8 a.m. and 4 p.m. to ask questions and learn more about the benefits of medical hydration therapy. Visit innovativemedicalassociates.com to schedule your free in-office consultation with Dr. Molly Fantasia today. We are back here on Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates. If you want to call them, feel free. 856-489-0505. 856-489-0505. You can ask them any questions, but most importantly, what you want to do is make an appointment to sit down with Dr. Molly and get that initial consultation, and you can really get your questions answered. 856-489-0505 is the number, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that. Health Watch is the show, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Our number here in the studio, 855-839-1210, 855-839-1210. Kind of dovetailing onto our earlier discussion, sure. Dr. Molly, why do you use hydration?
Well,
why is that the vehicle?
Well, the vehicle is hydration because we're able to actually replenish the necessary natural and sometimes pharmaceutically. We're also able to deliver pharmaceuticals in an appropriate dose to effectuate the change of the medical challenge and to improve the quality of life. But overall, what happens is using hydration actually can replenish and support the needed biochemical, which goes right up my alley, the biochemical processes that are going on in our bodies every day from the time we're born and take our first breath to the time we pass on to the good Lord's arms. And that is why I love hydration. We are able to boost your energy, boost physical stamina, and we're able to support these complex, and I'm not going to go into it because it's the one thing most scientists and certainly most pharmacists and I talk about all the time, the Krebs cycle. But it is a complex biochemical cycle that goes on that really is responsible for our life cycle. And it's really necessary to get to the right cofactors as well as the vitamins, minerals, amino acids that the body needs. So in boosting our energy, I'm talking about cellular energy, John, energy on a molecular on a molecular level, well, then what? It will improve our physical stamina. It helps the body detox. It can help the body deal with pain, chronic pain. It can reduce fatigue, as in regular fatigue. For example, you didn't get enough sleep that night. Well, it's a hydration therapy can actually help in that way. Medical hydration therapy, using the appropriate nutraceuticals or the constituents of those nutraceuticals to help a patient do these things. So that's the basic reason why I use hydration.
It would seem to me that you were just describing that maybe hydration would be something you could have your entire life.
Right. In fact, it was an interesting thing back in the day when we had another co-host. Do you remember who that was?
Yes.
He was telling me about, he used to say, follow the money, guys. He would say, Molly, I found out in Hollywood, so many people are using this. Why? Because of the stars and the executives and that kind of thing. They were using hydration, and my goodness, we've improved hydration since then. We're talking 20 years ago.
Yes.
We believe in medical hydration. We've improved it so much that we are able to help people across the board with challenges before they become chronic. That's the key, John. Why is it people don't get in early enough to see me?
Well, you were saying that earlier. It's like they come in now.
It's mind-blowing.
They come in now, and
yeah.
there's like 5 challenges, as you said.
Right. Here's the thing. I know my cancer patients are a good example. I tend to get them after they've been diagnosed on stage 4. Why? Come to me when you're at stage 0, when they've just found this. Now, that's happening more and more because people are becoming more and more aware that we can affect some of these changes on a molecular level if used in medical hydration. I'm not talking about the drunk tanks. I'm not talking about just looking beautiful. I'm talking about effect on this complex biological, biochemical changes that the body has every day.
There's a difference between what you're doing and these spas.
Absolutely,
so
unequivocally,
okay.
Without a doubt.
And how would people know that? In other words,
just come in my clinic.
Okay.
Just come into my clinic and see what we're doing. Okay. Come into my clinic. First of all, my range of nutraceuticals will knock your socks off. That's first. Secondly, my extractions, and all my pharmacy friends out there who are listening, they know I believe in the compound pharmacy. I know that the compound pharmacists are my dear friends because they understand the nature of using natural substances and what it is I'm trying to get at. So I'm able to get appropriate dosing, certainly different dosing and indifferent from lowest to highest. So, and we're not afraid to use it. That's the other thing. And have.
You have 600 and some protocols, I think now.
Variations, yes.
So, yeah. I mean, you have something for...
Well, listen, we started with cardiac 27 years ago.
Yeah, you started with that, and now it's up to 600 and some.
Well, and because there are so many variations, because, again, I'm looking at the total patient. For example, patients come into me. Very interesting thing. I had a young girl come to me. Father's in charge of her condition, even though she's 36 years old. She had hydrocephalus when she was born and all of these complications. And he goes, well, I don't know about your dosing, Dr. Molly. I said, well, my dosing is going to be appropriate to what we need to do for this young lady. But in addition, I need to run her kidney functions. I need to see some other things to make sure that you just don't come in and sit in my chair. You come in for your free consult. We ascertain what we're doing. I'm looking through your old medical records. You're going to sign releases for them. And we're going to give you an appropriate dose the first time to see how you do taking the fluids, these kinds of things. There's a real process that goes on in my head and in our clinic. So that is the difference which we do. You go into these spas, you can go, in fact, listen, John, we're down here in Atlantic County, right? You can walk in, there is a quote-unquote hydration clinic in a casino. Okay, well, I'm going to tell you, they sure as heck
You can
are.
gamble while you're.
Well, they sure as heck are not running your kidney numbers. They're not running
No.
your liver numbers. They're not running any of that because they're doing some, they're doing what we might do in your very first treatment, which is to tiptoe into it. But that's all you're ever going to get from them. Point of what we do is we want to effectuate the change.
And again, you are a medical
We
facility.
have 2 physicians, no waiting, that's the joke, and we also have registered nurses who are doing this in various capacities.
Let's talk about, and I know you wanted to do this, so it's a good time to do it, an overview of peptides. Because
peptides. I love peptides.
You're doing more and more of this.
Peptides.
Can you tell us more?
There's another thing. See, this is what separates us from a lot of these other clinics. We've been using peptides for at least the last 5 to 7 years. And peptides are small chain proteins. They're smaller than the amino acids that a lot of places get that are out there commercially. So peptides have a high bioavailability, which makes them ideal for conditions, medical conditions like cancer. In fact, all the new actual drugs that are coming out, the pharmaceuticals that are coming out, are really based on peptide science, John. Peptide science. And we've been doing this for years. And there are many natural occurring peptides. So we believe in these. They can improve. We've used it extensively in regenerative medicine, but we use it also in all of our hydration.
So the benefit of peptides is?
It can be anti-obesity. That's the big thing right now. That peptide diet that's out, that's a big one. We have it, we use it, but I believe we use it in conjunction with our hydration as well as giving the shot that the particular peptide that works on the GI tract that is doing. We all know there's a traditional med out for it, right? There's
Yes.
a traditional, everybody knows because it's really stopped a lot of the diabetics from getting their meds. But we actually use an enhanced protocol that actually works. And I will tell you, as of this week, I lost 40 pounds. I'm right at where I want to be.
That's terrific.
On this particular protocol that I'm using.
And this protocol, this dietary protocol,
Right.
it works with peptides?
Right. It works with a peptide, and then what we do is we use the cofactors utilizing. I see a patient at least once a week or once every 2 weeks while on our program, even as we wind it down, meaning once you go through it.
You've lost 40, and just give us an idea.
Well, I have another patient. He's lost 20 in, I think, 3 months. I have another young lady who lost 30 in 6 months. And the idea is you want to go slowly, steadily, and not give them the nausea. That's usually that can happen. Here's the thing. Peptides, for the most part, just like most nutraceuticals, have a very positive safety profile, but they have some downside. You must use appropriate doses. And you can, with compounded peptide, you can actually look at the dosing specific for the patient. For example, in the traditional protocol, they start you at a certain dose. Well, guess what? We found that starting the patients at that traditional dose for the non-traditional treatment might be a little bit too much. I had a patient in the beginning that had tremendous nausea, was starting on the traditional dose that most of the weight loss clinics are doing. Well, if we can avoid that, even if it's a little longer time period that you might lose, why wouldn't we do that? That's the beauty of the compounded peptide.
We are coming up on our halfway point of the show, and that means it's time for a break. We have plenty more to talk about here on Health Watch. That's the show, Health Watch, 8 till 9 every Sunday, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, our number here in the studio, 855-839-1210. Maybe you heard something about this peptide diet. Well, if you've tried to lose weight, maybe you want to talk to Dr. Molly about it. She's available. 855-839-1210 is the number, 855-839-1210. I'm John DeMasi with Dr. Molly Fantasia. We both return with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, 856-489-0505, 856-489-0505. You want to call and make your appointment to sit down with Dr. Molly for the initial consultation, and it is complimentary, so it doesn't cost you anything, and you will certainly, I can guarantee you will learn a lot. 856-489-0505 is the number, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Our number here in the studio, if you want to talk to Dr. Molly right now, 855-839-1210, 855-839-1210. Continuing our discussion, Dr. Molly, of peptides, and I understand that you use it a lot in regenerative medicine.
Right, like with PRP that we talk about,
Yes.
platelet-rich plasma, and some other things, other plasmas that we use, or other types of injections that we use for patients. One of the things that we found is that in combination with certain peptides, we're able to improve the healing post these injections. In other words, for example, we had a patient who came in with a torn tendon, and we were able to really enhance his treatment protocol. He actually ran a marathon just recently. From this, he had torn his Achilles tendon, and we were able to repair this in a much quicker way by utilizing the peptide along with the PRP. So again, it's because there are certain peptides that are anti-inflammatory, certain peptides that absolutely can help in bone and ligament and tendon. And so the idea is to use the appropriate peptide along with the appropriate protocol, and then follow up with a hydration protocol that actually nourishes this entire process. So there is a process that we use in our regenerative medicine. You don't just, bam, come in, get the shot, and go home. Well, we found that doesn't work. What we want to do is utilize every substance that's within the framework of our black bag and utilize this. And God bless my physicians because they were open to doing this. And again, look at the safety profile for these peptides. They're very good if used in the appropriate amounts and used in the appropriate system.
As opposed to getting surgery.
Oh, my gosh, yeah.
Which, I mean, with Achilles, that's a 6 month at least
right.
injury when it comes to surgery.
Right,
so
right.
This is an alternative.
Right, and I will tell something else that I really do. One of the lab works that I'm doing is looking at our interleukins, which are proteins that we talk about, the interleukins and cytokines that actually can cause inflammation. When they're out of whack, they cause the inflammation that we have, like from rheumatoid conditions. There's another area that we're using the peptides in, and we can actually show patients that we've improved their, so when they were in the red zone or the hot zone, I like to call it, I've seen it coming down to normal. And we believe that it's the enhancement of the peptides that is doing this. Now, I'm collecting the data, we'll see. But it seems that just using the injection alone without the peptides, we found that this is just an enhancement.
Okay, we're going to go to the phones right now. We have Shirley in Lindenwold, New Jersey. Good morning, Shirley. You're on Health
Shirley.
Watch with Dr. Molly.
Good morning to you both.
Hi, dear.
Dr. Molly, I have a question in reference to fungus in the body. My son is 56 years old, and he just got out of the hospital, and he has congested heart failure.
Oh, my gosh. I'm sorry to hear that.
Now, and I'm looking at, I think he's just filled with fungus because his toenails are thick and crusty. Each one is, his skin color has changed. His eyes aren't the same. And what are your opinions on this fungus?
Well, you know what? This is very interesting because I see a lot of that many, many times, Shirley, in our cancer patients have this kind of problem. Is his tongue white as well? Tongue? Like
well,
there's a white...
I haven't noticed his tongue.
Okay, well, this tongue, it will probably have a white coat on it as well. It's really like a film. So there are several things that he can take, several drugs he should be on maybe. He needs to be on an antifungal. But the other thing we do is we have a protocol for that might help. I'm a little hesitant to talk about it on the radio, but it might help, and it utilizes some natural antifungals. But do I believe he has this? Yes. But I also am concerned about his congestive heart failure. Is he taking any type of vitamins or herbal supplements for his congestive heart failure, dear?
Well, I have him on some alpha-lipoic acid, olive leaf, and a powdered green drink.
That's good. Also put him on some hawthorn berry for his congestive heart failure. Listen to me. And get yourself a good brand of that. Don't go inexpensive on the hawthorn, okay? Hawthorn he needs. The other thing is you need to make sure he goes on coenzyme Q10. Coenzyme Q10.
Oh, I had him on that too.
Good girl. How much do you have him on, Shirley? How much?
Well, it's a low dose. I think it's like 100.
Oh, no, honey, bring that up. When you have congestive heart failure, you know what's going on a cellular level. He's not making the cellular energy. So let's get that up. And how's his diet, Shirley?
Well, he doesn't eat. Well, he's a diabetic. He has high blood pressure. His system is all haywire, and he doesn't eat beef. He doesn't eat pork. Good. And he eats, let's say, one meal a day. And I have to get him off the juices.
Yes. Oh, Shirley, you need to come work for me. You're on it. You got it. Get him off those juices. That's absolutely right. It's too much sugar. Listen, the other thing that you're making a really good point about is, those comorbidities contributed to his congestive heart failure. There is no question. John and I talk about this all the time. These comorbidities are things that people have to look at. And good nutrition at home is important, and antifungal. Make sure you stay away from foods like cheese. Cheese, right? Cheese has a lot of potential to have some fungus in it. So, I would definitely, you got them on the right stuff, and I would continue. You're doing a great job, Shirley. Thank you. Thanks for this call, dear. God bless.
Thank you for the call.
That's a nice
and
call.
Keep us posted.
Yeah, I hope he's doing well. There's a case, John.
Yes.
You don't take him to a spa.
No.
Okay?
No.
Because why? Congestive heart failure, we have to worry about fluid balance, check his kidneys, all those kinds of things. But do I do a good job on congestive heart failure? You bet. You bet.
Let's get back to peptides and regenerative medicine.
Okay.
I wanted to ask you, so if you have this procedure done where you
insert some cells, you insert PRP, platelet-rich, or cofactors to help healing, yes.
What is the time frame for that as opposed to surgery?
Well, I would say we start to see improvement in 4 weeks, but it's the kind of thing where you have to be willing to do this. Now, we know, for example, and I read the current medical and scientific literature, we know, for example, that athletes are doing this all over the country, and they're doing it with these pretty high-class orthopedic practices. The problem is people like our patients, you and me and our listeners, don't know that this is out there and can be done safely, but it can be. And for patients who maybe are a little bit older, when you're 70, 75 maybe, it may take a little longer for us to get the kind of healing we need, but ultimately it does come about if utilized properly, and it's the appropriate type of tear, it's the appropriate type of injury. But trauma is definitely improved with peptides.
Is there one situation where it works better than another?
Well, we've seen it work for knees a lot. We've seen knees, we've seen hands, wrists, and again, ankles. We've seen it work really well in those cases. But again, I've used peptides for other things. I've used peptides. There are a group of peptides that can help a patient with congestive heart failure, for example. So in their IV, they may get a peptide. So I don't want people to think, the point of this is, don't think it's just for regenerative medicine. It is not. It can be used for other types of enhancements.
And so peptides really encompasses
Are
a lot of things.
Broad-based, and there are many of them. And I'm telling you, more and more research is being done for the use of peptides with cancer patients, absolutely and unequivocally. In fact, a lot of the new immunotherapies that are coming out are based on peptide theory.
Speaking of cancer patients,
Sure.
You want to give us, before we head to our final break,
Okay.
you want to give us an update on your cancer patients?
Well, okay. 3 of them have had PET scans that have shown no growth of their tumor, no new lesions. That is excellent. We feel like, and they're doing pretty well with their stamina. And again, they've come to me at stage 3 and 4. I would so much more prefer patients to come to me at stage 1. And again, we don't need to interfere with conventional treatment. And why is that? Interesting enough, I had a situation this week where one of my patients is going to my friend, the oncologist. He's a friend of the clinic's as well as a great person and a great resource for us. She was going up there for a form of chemotherapy. So her guardian, her father, was very upset that I might want to do a treatment right after she receives the chemo. And I said, well, no problem. I'll send it up to the doctor's office and let him look at what I'm putting in there. And if he gives me an okay, I'll show you. Well, he did give me an okay and said, do your protocol, and a big smiley face. Now, I also use vitamin C during this, but not at that time. In other words, you need to use the antioxidants appropriately for these cancer patients, even when they're in getting radiation or oncology treatments, because you don't want to interfere with the oncology. So you might not do that the day after. You might do that 2 days after or so. So you really got to know how you're doing it. You don't go to a spa for cancer treatments.
Yes,
or cancer supportive treatments.
That's for sure. We're coming up on our final break of the morning, and Dr. Molly is going to give us an update on some of her other patients as well, and more of your calls at 855-839-1210. Our show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, the number here in the studio, 855-839-1210. We have time for 1 or 2 more calls here on the show, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. More of today's Health Watch after these words. We are back here on Health Watch. And again, the number, operator standing by at Innovative Medical Associates, 856-489-0505. I'll tell you again, 856-489-0505. Call and make that appointment to sit down with Dr. Molly for the initial consultation. It is complimentary, doesn't cost you anything, and you will certainly learn a lot. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And normally we have our Health Watch replay at 4 this afternoon, but we understand that there's a Temple basketball game. So Dr. Molly is an alumnus.
Yeah. And you know what? That's great. Okay. Temple had some tragedy this week.
855-839-1210 is our number here in the studio, 855-839-1210. Want to talk about, Dr. Molly, you're going to give us an update on the post-stroke patients.
Yeah, sure. One of our post-stroke patients is doing extremely well. What's happening is that cognitive ability seems to be coming back. John, how are you feeling?
I'm feeling great.
Okay, good.
I'm feeling great.
Good. You certainly sound like your old self. I mean, it did take a little bit of time, but you're back. The point of this is, again, what we've done is an enhanced treatment for our folks, an enhanced nutritional treatment to, again, have the give you enough, supplementation to help your own neurotransmitters get back into gear. And as a result, they're doing pretty well. Also want to give you an update on Rich, who is one of my nurse's husbands. I spoke to him yesterday. He's having a tremendous amount of pain because he has scoliosis. separate issue from what was going on with his Parkinson's. But I tell you what, this poor guy got the trifecta, right? I mean, you know, and we are worried about him. So, of course, he has an appointment with his pain management person, and I'm glad he is. But he mentioned in the call yesterday, because I called to do a follow-up, he said he wanted me to know that he felt like whatever I gave him last week really helped his Parkinson's syndromes. And this, to me, is a win. In other words, we may not be able to treat every single comorbidity you have at any given period of time, but little at a time, we may be able to get to them all. But it does take time, John.
Yeah, and you've always said
not holy water.
It's not holy water.
Right.
And it's the Goldilocks theory.
Yeah,
that
just
you,
right.
Just right. So that's a win that he's feeling a little better.
Exactly. So I really appreciated him telling me that because I was a little disappointed about the pain level. Now, we do address pain vis-a-vis anti-inflammatory issues. One of my other patients who's got terrible arthritis, rheumatoid arthritis, Sandy, she said to me this week she's had a terrible week. See, the change in weather, etc., has also affected my patients. And she said, I got to tell you, Molly, I had a couple of very good days. And I know that is a win for me, because it gave her a couple of days to go to Sam's Club, Costco, these kinds of things. For my patient, that's a win. Did we cure the arthritis? No. But this is the key. We're not curing anything, but boy, I want to know what your goals are and how do we get you to them.
You had another interesting case this week, and I really find this interesting, because a guy brought his girlfriend in.
Oh, this is an interesting case, yeah.
And
she's my, yeah.
She works for a doctor.
Yeah, a GI guy.
And she has GI problems.
Exactly.
And they told her,
well, this is it. Nothing we can do. Well, you know what? I really think that she's got convoluted problems. I think she has a couple that are overlapping and that are causing her this problem. She started with her first treatment last week, or this week, I guess. I called them yesterday. Her boyfriend said, oh, Molly, I wanted to call you. She's doing a little bit better. And she said she couldn't believe it. I said, yeah, I can, because there was an issue where I used a peptide for gastric, for example, and also used some homeopathics in a dose that work for her, as well as using a tincture of a traditional drug that isn't usually used for GI problems. So again, John, this is the kind of protocol. It isn't one size fits all. This woman, I believe what she has is a problem with her pancreas and the delivery of her the enzymes that the pancreas puts out to help with the digestion in the lower tract. And the other thing is, we put her on a group of oral enzymes that she's taking, which we know will help, and not the prescription one.
So this is, again, a variety of things.
Right, within the framework.
Right, yes.
Within the framework of what she presents with. Because sometimes what we present with is not the underlying issue. That's interesting, and that causes me to do archaeology on your charts. You will find that I will ask people, can we get a hold of your previous, doctor's notes, this kind of thing, because it helps my docs and myself when we have our team meeting to say, okay, this is what we've all picked up. Each of us differently picked up a particular issue, and how do we put it all together for an IV?
Another update, your MS patients?
Oh, they're doing great. They're doing really well. In fact, I would say that in all of the neurodegenerative diseases, they're doing very well. Dr. Pat actually went to her neurologist and had her update, and the neurologist said, well, no new lesions, and her overall improvement, meaning her scores that they do the qualitative test, have all improved. So Dr. Pat said, I'm a little disappointed that my old lesions are... But when she thought about it, she said, well, that's scar tissue, Dr. Pat. How would that improve? And Pat said, of course, you're right. It's scar tissue. But my point is that she doesn't have any new lesions, and we thank God for that. And again, it's the doctor upstairs that's really calling these shots.
Yeah. As far as any other patients, do you have anything else?
Our post-COVID people are doing okay. And again, I want to say, look at where you go for this hydration therapy. We really are a medical hydration therapy facility, and we do it correctly. In that, for example, I had a situation where we had to order oxygen for a patient. Well, in order to just get oxygen today, John, you've got to really have a lot of data to support the need for oxygen, thanks to what's happening right now in our political system. So this is for a Medicare patient, by the way, which used to be so much easier. All you needed was a couple of oxygen results. Now you got to do a whole thing. But anyway, God bless my nurses. They took care of this. We ordered the oxygen. The patient is doing fine. My point is, you're not going to get that at the spa.
You know, you've talked about long COVID.
Oh, it's horrible.
And I'm hearing more and more
again
that this is becoming a problem.
Yes.
And it's looking like it's going to be here for a while.
I think it's going to be with us forever. I think between the long COVID and between the I guess the vaccines, and maybe some people have had, had some negative results from the vaccines. And again, I'm not an anti-vaxxer, everyone, just hear that. But the point is, people are suffering from this, and as a result, they're in our chair, and they need really specific types of protocols depending on the symptoms they have, not just the lung conditions, all right, but others. For example, the fatigue, just the the mental clarity issues, the brain fog, all of that takes certain specific protocols to really address. So we have to then really itemize, what does the patient want to effectuate the change in first?
So I guess you have a protocol for the long COVID.
Of course, but again, it's going to vary a little bit by the patient. This is why I say not one size fits all. You can have a protocol for vitamin C therapy, one protocol. It's out there. It's big.
Yes.
Okay. That doesn't do it for every patient. Same thing with the protocols we do. That's why you need these variations. You've got to say, what is it that the patient wants to accomplish, and how do we get there? And then what's the next thing and the thing after that?
It's like hitting a moving target.
Exactly right. And I will tell you, it is an amazing thing, because I'm seeing more and more people who are relapsing for COVID. How about all the relapses? Okay. They're testing positive. I don't know. Are I'm beginning to think that these home tests are skewed, which I always believed. As a scientist, I believe that there is better testing in a facility than you will get at the home test.
And of course you do that
of
as
course.
well.
Of course.
Well, that is about the time where we say we're putting the wraps on another edition of Health Watch. Don't forget, Dr. Molly Fantasia is available, and you can call the operators right now to schedule that appointment for the initial consultation. 856-489-0505, 856-489-0505. The operators will be there well after we leave you at 9 o'clock. In fact, they'll be there all day. You can call, or you can call tomorrow, 856-489-0505 for Innovative Medical Associates. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, and Catherine, and of course there's Joanne, and fabulous Fran, and delightful Dee, and our nursing assistants Sandra and caring Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next week. Health Watch, 8 till 9, here on Talk Radio 1210, WPHT. You take care.
Thank you, Jim.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.